Hi, my name is Erin Green, and in our Communications 201 class, we are learning about informative speeches. And for my informative speech, I'm going to be talking about medication errors. Now, medication errors come in many different shapes and forms. One of them can be from the physician when they're writing out a script that is very difficult for you to read. You take it to your pharmacist. They have no idea what the medication is for, so they're kind of guessing and checking as they go. It also falls onto the nurses when we don't do our proper job of explaining what the medication is for and how they're properly supposed to take it once they go home. And it also falls onto the patient for them not asking the proper questions, asking for that clarification, and fully understanding what is expected of them once they get discharged. In this article by DJ Williams entitled Medication Errors, he mentions that there's two different types of medication errors. One of them is mistakes, which is errors in planning actions, and the next one is skill-based errors, which is errors in executing correctly planned actions. And the first one for mistakes is knowledge-based errors. Like I was explained, it really falls onto the patient for a lot of the information that they don't know. A lot of the times patients come into the hospital and it's their very first time being in a hospital, and it's a very scary time. And there's this wonderful video from YouTube where this gentleman is talking to his physician about what hypertension means, and he thinks that means you're hyper, which you can't sit in a chair, you're very just fidgety. And the doctor explains to him, no, your hypertension medication is for your high blood pressure. And the patient couldn't correlate that hypertension and high blood pressure are the same thing. So making sure that we as nurses, as doctors, are aware that some patients don't know all of the medical jargon that we know, and making it user-friendly to them so that they can take their medications and that they are compliant so they're not coming back into the hospital for the same things. And then the next one for skill-based errors is action-based errors. Now, one of the best examples that I can think of during my nursing school career is when my professor was teaching this patient who was newly diagnosed with diabetes how to properly administer his insulin once he goes home. So she's like, you take the vial, you take your syringe, you get the amount of dose depending on your blood pressure, your blood sugar, and then you administer it to yourself. And of course, since she already gave him his insulin, she used an orange as a diagram for it. And she wasn't aware that the patient didn't understand that the orange was supposed to mean for him. So a couple weeks go down the line, he comes back into the hospital for the same thing. And when she's asking him to explain to her about the insulin, he explains that he was giving the insulin to the orange and not to himself. So trying to establish that barrier and making sure that we are properly educating our patients before they leave the hospital, and differentiating from them that this object that I'm using as a representation is you, and preventing those medication errors from happening. In conclusion, medication errors in the hospital and in nursing home settings are very common. It will continue to be a common thing as our population grows older and older, as new nurses become younger and younger. So we need to make sure that not only are our patients aware that medication errors can happen and how to give them the right tools to prepare, also giving the nurses the correct tools, and making sure physicians are on the same page. Thank you.